Well, good afternoon, everyone. Again, this is Kristen Burke. I am the National Marketing Coordinator here at Art Jeter & Company, and we are going to have a webinar today in regards to Medicare 101. So I know there will be a few more people trickling in here, but we wanted to start right at the top of the hour. I do want to let you know that this call is being recorded, so we will be able to have this available to your access. Just request that at the end of the webinar. We can send you a copy of the recording. If you have questions, we will have the lines muted for the call just to kind of help minimize any background noise. If you have questions, you'll see in the little chat bar for GoToWebinar, there's a chat feature. You can simply type in your questions there, and I will address any questions that come across at the end of the presentation. So we'll go ahead and get started. As I know, everyone's schedules are rather busy, but I do appreciate you guys taking the time to join us today, and we'll go ahead and get started. So you probably have all heard at some point or other about the baby boom generation and how it is really growing tremendously. So you can just see in this illustration that there are, over 60 million individuals that are on Medicare or potential Medicare enrollees as of 2018. And you'll see in this graph that it continues to increase and grow to about, I would say 84 million come 2030. So tons of opportunities to really help these clients with their Medicare needs, as they really need a lot of guidance. So Medicare, kind of high level, we're just going to give you some information in regards to Medicare and all the components that make it up. So it is a social insurance program that was established in 1965. As of really last year, there was about 55 million individuals that actually do have health coverage through Medicare. And that really consists of individuals that are 65 and over are, eligible for this type of coverage. They say nearly, and I've heard also too, over 10,000 baby boomers are turning 65 each and every day. So I know that you probably have clients that are in this pool or are approaching it here within this year or years to come that would love your assistance. Also, individuals that are under age 65 automatically get Part A and Part B after being on a disability benefit through Social Security for at least 24 months. So they would also be entitled to receive Part A and Part B of Medicare. Individuals that have ALS or Lou Gehrig's disease automatically get Part A and Part B the month that Social Security disability benefits begin. Also, individuals that have permanent kidney failure have access to Medicare Part A and B as well. So what makes up Medicare? There's various different parts of Medicare, and so we're just going to kind of talk high level again about what makes up Medicare, as then you can go and talk with your clients and see what is the best avenue for them. So Part A of Medicare is the inpatient hospital or skilled nursing hospice. That's kind of all-encompassing of the Part A. Part B is more medical services, so doctor, outpatient, things like that. And we'll get into more details about each of these in just a moment. Part C consists of, or better known as, Medicare Advantage plans. So that is, in a sense, an alternative to Part A and Part B of Medicare. Then there's the Part D, which is the prescription drug coverage. So as I mentioned, Part A and Part B together represent original Medicare coverage. Now, there's also some late penalties that your clients should be aware of as they turn 65 or picking up Medicare that they need to be aware of, because it could really hurt them down the road. So Part A, there's an inpatient hospital. Again, that's that portion of part of Medicare, the inpatient hospital. If not eligible for premium-free Part A, then there's a premium. That premium may increase 10% for twice the number of years missed. Part B, which is the medical services, they could see a permanent Part B premium increase of 10% for each full 12-month missed if they did not enroll in the Part B of Medicare. So then at that point, they would have to wait until that general enrollment period, which is January 1st to March 31st, to enroll, and then their coverage would start July 1st of that year. Also, with the Part D, if they delay enrolling in that, they could see a 1% permanent premium increase for each month without credible coverage. So really explaining this to your clients, providing them some knowledge about this is definitely beneficial. Now you might think, give me a little bit more information about Part A and what makes up those coverages, as well as what's the client's responsibility. So if someone just has Part A of Medicare, they're going to receive some coverage for sure through Medicare for inpatient hospital care, skilled nursing, hospice, and blood. However, there's going to be some out-of-pocket expenses that are associated with that. There's a misconception out there that I've paid into Medicare for years and years, so Medicare should really take care of me once I turn 65 or over and I'm on Medicare. However, there are some out-of-pocket expenses that they need to be aware of. So if they happen to be hospitalized, they do need to pay a deductible of $1,340. That will cover the first 60 days of that hospital stay or satisfy that. If they happen to be still in the hospital from 61 to 90, then they would have to start paying out each day $335. If they happen to be still in the hospital from after the 91st day and beyond, there's going to be a fee of $670 that they're going to have to pay each day. Now, you're getting into, after that 90th day, you are tapping into that 60-day lifetime reserve, which is only given one time that they are on Medicare for the life of their, that Medicare coverage. So after those 60 days are utilized of what is considered that lifetime reserve, then all costs are going to be the responsibility of that individual. So it can be quite costly. Skilled nursing, the first 20 days are covered. However, day 21 to 100, they would need to start paying out $167.50 per day. After the 100th day, then the individual is responsible for all costs. Hospice, there is a copayment of $5 per outpatient prescription and a 5% of the Medicare approved amount for inpatient respite care. And then blood, the individual is responsible for the first 3 pints of blood. And I've had that question before of what does that cost really look like? Well, for the first 3 pints, it does vary from state to state. So you would have to check with your SHIP office to see exactly what those costs entail. So these figures are, again, just associated with if somebody had Part A of Medicare, and those figures are for 2018. So they do increase and change each year. So you will be working with clients that, or you may be working with clients that have been paying into and working in a Medicare covered employment for at least 10 years. In most cases, you're going to find beneficiaries that are in that category. So they're not going to have to pay a premium for the Part A. However, you may run across an individual that has less than 10 years of Medicare covered employment. So they can still actually get access to the Part A of Medicare. They're just going to have to pay a premium for that. And how that kind of breaks down is if they have less than 30 quarters, then they're going to have to pay $422 a month for that Part A premium. If they have 30 to 39 quarters of work through a Medicare covered employment, they would have to pay out $232 a month. If receiving the Social Security retirement income, then they're going to be automatically enrolled in the Part A at age 65. So keep that in mind too. So simply just ask your clients, are you currently or will you be receiving your Social Security retirement income at the age of 65? If they say yes, then just let them know, then they would automatically be set up with the Part A of Medicare. So that's Part A. Now looking at Part B, this is going to cover more of the medical side. Doctor services, preventative, outpatient, diagnostic tests, therapies, durable medical equipment. That's kind of all-encompassing under the Part B of Medicare. There is some out-of-pocket costs that are associated with the Part B of Medicare. Each year there's an annual deductible, and it can change. I've seen it where it's gone up, it's gone down, it stayed the same, so it does fluctuate, let's just say. So for 2018, that annual deductible is $183. After that deductible has been satisfied, then the individual is responsible for 20% coinsurances for most services. In addition to that annual deductible, an individual will have to pay out a Part B premium. And now this is all based off of their income and how they filed it with taxes 2 years prior. So if their income in 2016 was $90,000, let's just say, for one individual, then they would actually pay a monthly premium for the Part B of $134. Then you also see that there's joint filing categories as well. So if it's a husband and wife, you just need to look to see how their how they filed their taxes and what their income was back in 2016 to determine what their monthly Part B premium would be for 2018. So again, this can change each year as well. We did see some changes from 2017 to 2018. And now are all reflected here on this slide. Now you might wonder, how does one enroll in the Part B of Medicare? They will start receiving information about 3 months or so prior to the month in which they turn 65. So they'll start getting information in the mail from Social Security, from Medicare, stating that their enrollment is approaching. So typically what we see is individuals will actually enroll in the Part B of Medicare a month or two prior to the month in which they turn 65. It is really wise for them to actually pick that up prior to the month in which they turn 65. If they delay their waiting for their enrollment, then they could see some delays for coverage with that. So the best case scenario is if you're talking with your clients at they're 64 and a half years old, start letting them know what's going to be coming, to them and helping them make this transition. They can also enroll with, some other coverages during this window of time as well, and we'll get into more details about that. We also hear this misconception that Medicare is going to cover everything. So I'm not going to have any out-of-pocket costs, or I'm going to, and everything is going to be covered. Well, that's really not the case, as you can see here. Dental insurance, eye exams, hearing aids, long-term care. These items listed here are not covered by Part A and Part B of Medicare. So again, they need to make sure that they know if they're used to having dental and vision coverage through their employer for years upon years, now they shift over to Medicare, they're not going to have that coverage. So this gives you the opportunity to do some additional cross-selling, maybe to a dental plan, maybe to long-term care, and really make sure that they have the knowledge that, what they have available, what's covered under Medicare and what is not, and opportunities for you to give them that peace of mind, for future. I do like showing this diagram because it really kind of helps break down the different pathways, if you will, within Medicare. It is very confusing for seniors. It's in the media quite often, and they tend to, get confused with what is Original Medicare, what is Medicare Advantage, what is Medicare Supplement, how do they all intertwine, how do they all work together, or do they not work together? So even showing this illustration to a client can really help provide some clarity to what is Medicare and what is the best pathway for them to go down. So you can find this diagram actually in the Guide to Health Insurance booklet that CMS puts out each and every year. So it is client approved, so you can definitely, you need to give this copy to them so that they can read through all of this information. So if you go down the path to the left, which is Original Medicare, that consists of that Part A and Part B, which we already went through. Then they can also select a drug plan through Part D, so a prescription drug coverage. And then after that, they can look to see if they want to pick up a Medicare Supplement plan that would help cover those copays and deductibles that we just talked about for Part A and Part B of Original Medicare. Or if they want to go down the path of a Medicare Advantage plan, which is in a way kind of an alternative to Original Medicare, sometimes referred to as a Part C of Medicare. And it usually is a combination of Part A, Part B, and usually Part D. So it's like an HMO plan or a PPO plan. And so again, it's an alternative to original Medicare. You either have original Medicare or you go down the path of a Medicare Advantage plan. And then make sure that if the Part D is not included in that Advantage plan, that they pick up a Part D drug plan in addition to that. So if you join a Medicare Advantage plan, you cannot use or pick up a Medicare Supplement plan. So just want to make sure that they understand that as well. So as I mentioned, Medicare Advantage plans or Part C, there's some kind of regulations or some things that you need to be aware of or your clients need to be aware of when looking at this type of coverage. It is a great alternative, and great option for many clients that are out there. But it's intended to replace and replicate original Medicare. And it covers at least what Medicare covers, but you will still pay that Part B premium of Medicare in addition to a Medicare Advantage plan if the Medicare Advantage plan has a premium, and if it does, it's usually very minimal. So with Medicare Advantage plans, even though the premiums are zero or very low, there's going to be some out-of-pocket costs that can be quite high. So it is usually capped, but if they happen to be hospitalized, then they're going to pay some out-of-pocket costs. So they need to just, be prepared for that. With Medicare Advantage plans, you can only enroll or switch during certain times of the year. And you have to participate and only go to network-based plans and network providers. So if their hospital and their doctors are within that network, then it might be a great fit for them. Also keep in mind, as an agent, you do need to have certification with a Medicare Advantage plan. So each and every year, you need to go through the certification process for a Medicare Advantage. So if you have clients, again, that the network is working for them, they can't spend a lot, then maybe a Medicare Advantage plan would be a good fit for them. If you have a client that travels a lot or is a snowbird, I wouldn't recommend, I don't think, a Medicare Advantage plan, as it wouldn't cover them if they are out of network. There are some enrollment and disenrollment periods for Medicare Advantage plans. So there's the initial election period, which is centered around the months in which they turn 65. So 3 months prior to the month in which they turn 65, the month of their birth date, as well as 3 months after. Then there is the annual open enrollment period, which I think everyone is aware of, and that's October 15th through December 7th. And this is really centered around individuals enrolling into a Medicare Advantage plan as well as a prescription drug plan. But it's really come to be known as kind of their Medicare review time period. So even for clients that are on a Medicare supplement, they may just take the time to review their policy at that fourth quarter, that end of year, just to make sure that, where are they sitting and are they in the right plan? Maybe they need to reevaluate what drug prescription plan they want to, that they're currently on, and maybe switching to another one. There's also a special election period. So if they're losing any type of group coverage, then they are given 60 days from the date coverage of termination, so that they can then join into a Medicare Advantage plan. Or maybe they're moving out of a network area, or they have, they're losing their coverage from their current Medicare Advantage company. There's also the Medicare Advantage disenrollment period, which is January 1st through February 14th. Now looking at the Part D prescription drug plans, this is offered by private insurance carriers, and they are tiered drug pricing. So, really they provide very extensive maps that will show the various different areas, territories, regions of the country in which the pricing, the drug coverages are available in. So there's a lot of variables that go along with it. Now, Medicare.gov has a great tool that you can use too for looking at what coverages are out there for drug plans. There are copays that go along with the drug plans as well. They stand alone from a Medigap policy or Medicare Supplement, if you will. We kind of use Medigap and Medicare Supplement interchangeably. And sometimes a drug plan is included in a Medicare Advantage plan, which is called an MAPD. There are, as I mentioned earlier, a late penalty enrollment. So you want to make sure that they are aware of that. Now looking at Medicare Supplement. So as I mentioned, it's also known as Medigap policies. They are sold by private insurance companies. All of the plans are standardized, meaning that a Plan F in your state with one carrier is going to be identical in coverage to a Plan F with another carrier may offer. So they're all the same. Now there's a few states which have unique differences. I think, Minnesota, Wisconsin, Connecticut, they don't, in a sense, have standardized plans. So they work a little bit differently. If you're selling in any of those states, just let us know and we can work with you on that. Now the cost may vary by company, location, and plan. And that's kind of where they stand out with Medicare supplements. And Medicare supplement plans, they follow federal as well as state laws. So each state can have its own little special rules, but again, we can help you with all of that. And this is individual coverage. It is not a family or a group coverage, if you will. So Medicare supplements, they cover those gaps in Medicare that we talked about, those deductibles, coinsurance, copays. And what's nice is it provides an additional 365 days of hospital coverage beyond Medicare. So that's a great selling point, just to give that client some more peace of mind that they're going to have some more additional coverage if they happen to be hospitalized when they have a Medicare supplement plan. Guaranteed renewable, meaning that as long as that client is paying their premiums, then that carrier cannot drop their coverage. So it's another huge selling point in giving them great peace of mind. Another great feature is that they can see any provider that accepts Medicare. So no referrals are needed. Simply asking the question, does that doctor accept Medicare? And then in most cases, they do. So that would be, another selling point. They don't have to switch doctors in order to get coverage. Medicare supplement plans will cover what is considered the basic benefits. And here, this is what is listed out, what consists of those basic benefits. Part A, coinsurance for inpatient hospital care, the cost for 365 extra days of inpatient hospital care, as well as that Part A hospice coinsurance that we talked about earlier, the Part B coinsurance after the deductible, as well as the first 3 pints of blood each year. So that's going to be covered, what's known as the basic benefits. And you'll see here on this diagram that it's basically showing you all the plans that are available within a Medicare supplement, or what a carrier could potentially offer for Medicare supplement coverage. As you look from the left to the right, you'll see it, in a sense, it moves down the alphabet. Plan A is where those basic benefits, and B. K and L are plans that are not too popular. Not a lot of carriers offer coverage within K and L. The most popular plans are F and G. So that's really what agents are really pushing at this point in time. The Plan F, we have seen for a number of years, that really was the most sold plan for Medicare supplements was a Plan F, because it provided all of the coverage. So really that peace of mind that as long as that client's paying their premium, they happen to go into the hospital or seeing a doctor, everything is going to be covered. Now the difference between an F and a G is that Part B deductible. So with the G, it does not cover that Part B deductible, but and that Part B deductible, as I mentioned earlier, was $183 this year. But if you weigh out the cost difference, if you look at the premium differences between an F and a G, also incorporate that Part B deductible, your client could still see a cost savings with going with a Plan G. Most cases, you'll see with carriers out there, they're going to offer plans F, G, N, and A. And Plan A is typically where you'll see a lot of that under age 65. Those individuals will have the Plan A available to them. So this is also provided and available in the Guide to Health Insurance booklet as well. Now the doctor fix. Now many of you might have heard of the Medicare Access and Chip Reauthorization Act that was back in 2015, sometimes referred to as MACRA. This is really came about, I think, to help kind of cover or to stop the abuse, if you will, that the government feels with overspending for that first dollar coverage. So what they're doing is January 1st of 2020, they're making some changes to the plan's C&F. So Plan C&F will no longer pay that Part B deductible. But keep in mind, you might have heard out there rumblings that the Plan F is going away. And your clients that might be sitting and on a Plan F today might be approached by somebody saying that the Plan F is going away. That technically is not the really what's going on. Plan F is going to still be available to those individuals that had turned 65 and are on Medicare prior to January 1st of 2020. C&F will still be available to those individuals. What is going away, in a sense, is anybody that is turning 65 after January 1st of 2020 or getting onto Medicare after January 1st of 2020, plans of C&F will not be available to them. So they're kind of segmenting off the market. So again, the new enrollees after 2020 would not have access to C&F. So they also had changed the reimbursement formula for Medicare uses to pay doctors and replace the sustainable growth rate formula. So some things kind of behind the scenes in regards to that. So it really kind of rewards quality of care and not volume. So really trying to make sure that they are receiving the care, that they need. So that is to come. I don't foresee anything changing with that in the future. I think the government's got a lot of things on their plate as it is. So I don't, again, see any major changes with this doctor fix or MACRA, if you will, coming down the pike. Looking at the pricing for Medicare supplement plans, it can vary drastically. They can look at gender rating, so male, female. They can look at ages and different prices for ages. Tobacco, non-tobacco use could be a factor. Area rating, meaning different zip codes. Maybe somebody, rural versus urban, have different pricing around that. They could also provide discounts, a household or a spousal discount, as well as risk, typically meaning height and weight would fall into that risk category. Rate adjustments. Now, if you are used to selling life insurance, maybe long-term care or anything like that, when you hear rate adjustments, you want to run. That's not the case with Medicare supplements. In a way, you want to see rate adjustments. You want to see low, consistent rate adjustments on a Medicare supplement plan, really to keep pace with those raising Medicare claim trends, as well as the changes with the annual deductibles and copays. So if you're working with a carrier and you see that they have not had a rate adjustment in a year and a half, 2 years, you might want to wonder, when is that rate adjustment going to take place, and then how large is that going to be? So again, the more often they have a rate adjustment, the better, in a sense. Now, there's some ways in which a client can pick up a Medicare supplement plan. Most common is for individuals that are just turning 65 and they're just getting onto Medicare. So it lasts for 6 months, and it starts on the first day of the month in which the person is enrolled in the Part B of Medicare, and they're at least 65. So during this time period, an insurance company, they can't ask any health questions. They can't look at any medications. They cannot deny anybody coverage for a Medicare supplement policy. So this is their open enrollment. Sometimes carriers, too, will allow an application to be completed and submitted prior to their 65th birthday, and then it would just be effective the first day of the month in which they turn 65. So that is Medicare open enrollment. So no underwriting, no health questions, no looking at medication information. Now there's a guarantee issue. This is another way in which someone could avoid, if you will, the underwriting process. Typically, you'll see this for individuals that are past their open enrollment window. So they might be 67, 66, 68 years old. There are essentially 5 different scenarios that could trigger an individual to have a guarantee issue right. We will show you an example of kind of what those are. I won't go into detail, but I can just refer you to some information. But no health questions. With guarantee issue, the Plan G is not available at this present time. So they can pretty much pick up any other plan that's being offered except for the Plan G if they're in a guarantee issue. Keep in mind, too, carriers typically have and pay out a lower commission for guarantee issue business. So here is an example of what some of the guarantee issue rights that a client could experience. A lot of it is either somebody is, maybe they were on a Medicare Advantage plan, they tried that out for a year, and they did not like that Medicare Advantage plan, and they want to switch to original Medicare and pick up a Medicare Supplement. That would give them a guarantee issue right. Another situation would be if they are losing their employer group plan. So if they are losing that coverage, then that would give them a guarantee issue right, again, into any of those Medicare supplement plans that are listed, except for that, again, Plan G. You can find this information. It's just a screenshot of what is all the guidelines that are in that Guide to Health Insurance booklet that CMS puts out each year. If you have any questions, because it can be very confusing for a client, and when they're trying to explain it to you of what their situation is, give us a call and we can totally help you with all of that, because it can be a little confusing for them. So if they're not in open enrollment, they're not in guarantee issue, what's left? Underwriting. So they'll go through the underwriting process, which typically consists of health questions on the application, typically yes or no questions. They will look at their height and weight. They will look at medications. Some carriers also look at any type of pre-existing conditions. And also, I do want to also mention really quick is that with Medicare supplement plans, most carriers would allow you to talk to the underwriting staff so you can ask them any type of questions. We have an underwriter on staff here too that can help with that as well. Some individuals you may be working with also might have a health savings account, which is a tax-exempt savings account. Most of the time you'll see that with a high deductible plan, and the HSA plan would pay for qualified medical expenses tax-free. Just keep in mind that any enrollees after age 65 need to stop contributing to their HSA 6 months before Medicare's effective date to avoid any type of penalties with unauthorized contributions. As we kind of touched on earlier, Medicare supplements can be offered to individuals that are under age 65. So those individuals that are receiving Social Security disability payments for at least 24 months are automatically set up and enrolled in the Part A and the Part B of Medicare. So they could pick up a Medicare supplement plan as well. This is not regulated at the federal level from a Medicare supplement standpoint, but more so at a state level. So if a state offers and requires carriers to offer Medicare supplement plans to the underage market, then the carriers are required to follow that rule and that guideline. And in most cases, it's probably going to be a plan A that's going to be available to them. So, however, if you have a client that's, let's say, 62 and they are receiving Social Security disability payments and they have a Medicare supplement plan, they have Part A and Part B of Medicare. Once they turn 65, they would actually be granted a new 6-month open enrollment window, just like everyone else, when they're turning 65, and then they can switch into any other plan that's being offered. So as we had talked about, all the plans with Medicare supplements are standardized. So how does a Medicare supplement carrier really stand out? Well, there's lots of variables that go in along with that. Premium, plans offered, customer service, producer services, brand name. Do you need to tell and explain who that company is? Or your client might be asking you, hey, do you have XYZ carrier, as I am familiar that they offer Medicare supplements. Also, how long has that carrier been in the market? How long have they been selling Medicare supplement plans? What's their ratings, with AM Best? Any type of additional value add benefits or discounts. So there's various ways in which a carrier can stand out in the Medicare supplement market. We, too, can help you with in deciphering all those carriers for you. Another nice tool that we offer to our agents is there's a quoting engine that you would have access to. It's an awesome tool in the sense that you can really customize quotes for Medicare supplements, final expense, dental, hospital indemnity. You can really, just with a few clicks, see who has the hottest product in that area and really be able to shop the market. So contact or go out to our website, www.jetter.com, and you would be able to get access to that. So there's just tons of information out on this tool. It's a great piece, and we can help you with that too. It's nice because it will tell you, the ratings of the company, maybe who the parent company is, and then, there's just tons of information, household discounts, any type of policy fees, if they're associated with that. Does it provide, does it have an e-app with that company or does it not? So there's just tons of information that you can provide. Lastly, I just wanted to show you, not only do we offer Medicare supplement plans here at Art Jetter & Company, but you can see on the left-hand side of the screen all of the other types of products and services that we can offer to you. We do have market specialists that really focus on all of these different lines that can really help you with all of your clients' needs. We've been providing services to agents since 1979, so we've been around for quite some time. And we do, as I mentioned, have an underwriter here on staff that can help you. We can provide leads, free E&O up to $1 million, training, case management. We can help you with whatever you need, to make you successful. So contact us at seniorhealth@jetter.com. Especially if you want a copy of this presentation, just send an email to that email address and let us know, and we can send over a copy of this presentation to you. You can always contact us at 800-228-0008, and we'll be happy to help. So I'm going to leave this screen up, and I'm going to see if there are any questions at this point in time. So again, on your toolbar for the GoToWebinar, there's a chat box, and just simply type in any question that you have, and I will address that with the group. I know that we kind of ran over a little bit on time, so I'm sorry about that. I'd like to keep it at about 30 minutes. If you happen to think of any questions today, tomorrow, next week, again, we are here to help you with any questions that you may have. Let's give it a little bit more time here. Okay, well, I don't see any questions are coming through. Again, we are just an email or a phone call away, so give us a call, and I do appreciate you all joining the webinar today. All right, thanks, and have a great day. Bye-bye.